What is the most serious potential adverse effect of rifampin use? A. Liver failure. B. Gastric ulceration or bleeding. C. Nephrotoxicity. D. Seizures. The answer is A. Liver failure. Hepatotoxicity and potential liver failure are the most serious potential adverse effects of rifampin use. Patients on this medication must establish baseline liver function tests and be monitored for liver damage. None of the other conditions listed are associated with rifampin use. Aminoglycosides are primarily used for infections by what type of pathogen? A. Yeast and fungi. B. Both gram-negative and gram-positive bacteria. C. Gram-negative bacteria only. D. Gram-positive bacteria only. The answer is C. Gram-negative bacteria only. Aminoglycoside antibiotics are used to treat gram-negative bacteria. They have not been shown to be effective against gram-positive bacteria and are not antifungal. Recall the major difference between the gram-negative and positive bacteria are their cell wall composition. Gram-negative have a small proportion of peptidoglycan and a high proportion of lipopolysaccharide, while gram-negative bacteria have a large proportion of peptidoglycan. Which of the following is an example of an aminoglycoside antibiotic? A. Streptomycin. B. Clindamycin. C. Erythromycin. D. Azithromycin. The answer is A. Streptomycin. The only aminoglycoside antibiotic among those listed is streptomycin. Other examples of aminoglycosides include tobramycin and gentamicin. All aminoglycosides either end in mycin or mycin. However, this suffix is not exclusive to aminoglycosides. It is also seen in the macrolides, erythromycin and azithromycin and both macrolides, and in lincosamides such as clindamycin. Fluoroquinolones such as ciprofloxacin may cause which of the following serious side effects? A. Seizures. B. Liver failure. C. Irreversible peripheral neuropathy. D. Sudden tendon rupture. E. All of these. The answer is E. All of these. Fluoroquinolones, the most commonly prescribed of which is ciprofloxacin, carry a risk of all of the following adverse effects: sudden tendon rupture or tendinitis, hepatotoxicity or liver failure, seizures, and permanent peripheral neuropathy. Other adverse effects include Clostridium difficile-associated diarrhea, bone marrow suppression, Stevens-Johnson syndrome, tremors, and psychosis. The majority of these adverse effects are seen in higher numbers in children and the elderly. Which of the following antibiotics is least likely to cause Clostridium difficile overgrowth and Clostridium difficile associated diarrhea? A. Vancomycin. B. Clindamycin. C. Amoxicillin. D. Ampicillin. The answer is A. Vancomycin. All of the drugs listed frequently cause Clostridium difficile overgrowth and Clostridium difficile associated diarrhea except vancomycin, which is often used as a treatment for persistent Clostridium difficile infections. Which of the following antibiotics is contraindicated in pregnant women and small children due to its tendency to irreversibly stain developing teeth? A. Fluoroquinolones. B. Tetracyclines. C. Beta-lactam antibiotics. D. Aminoglycosides. The answer is B. Tetracyclines. Tetracycline antibiotics are contraindicated in pregnant women and small children due to their tendency to irreversibly stain developing teeth. They can also affect fetal bone growth and so are pregnancy category D, known incidence and risk of fetal harm. Which of the following antibiotics is considered safe in pregnancy? A. Gentamicin. B. Levofloxacin. C. Doxycycline. D. Amoxicillin. The answer is D. Amoxicillin. Of the antibiotics listed, amoxicillin is the only one considered safe in pregnancy. Doxycycline and gentamicin are both pregnancy category D, known to cause fetal harm. Levofloxacin is category C, fetal harm cannot be ruled out. Penicillin is used to treat what type of microbe? A. Gram-positive bacteria only. B. Fungal infections. C. Gram-positive and gram-negative. D. Gram-negative bacteria only. The answer is A. Gram-positive bacteria only. Penicillins belong to a larger class of antibiotics known as beta-lactams. These antibiotics inhibit cell wall synthesis and are exclusively used to treat gram-positive bacteria. They are not effective against gram-negative bacteria or fungi. The answer is A. Fluoroquinolones. Fluoroquinolones are considered to be the treatment of choice for E. coli infections due to their effectiveness in relieving diarrhea and minimal serious adverse effects. Aminoglycosides and beta-lactam antibiotics may also be effective, as a second choice. Which of the following class of antibiotics is considered the first-line treatment for E. coli infections? A. Fluoroquinolones. B. Tetracyclines. C. Macrolides. D. Aminoglycosides. The nurse considers administration of gentamicin. Which of the following is not a side effect of this medication? A. Nausea. B. Nephrotoxicity. C. Ototoxicity. D. Diaphoresis. E. Anorexia. The answer is D. Diaphoresis. Gentamicin, an antibiotic and aminoglycoside, inhibits protein synthesis of gram-negative bacteria. It treats severe systemic infections. It may cause ototoxicity and nephrotoxicity, as well as anorexia, nausea, vomiting, and diarrhea. Diaphoresis is not a common side effect of gentamicin. Diaphoresis is the medical term used to describe excessive, abnormal sweating in relation to your environment and activity level. It tends to affect your entire body rather than a part of your body. This condition is also sometimes called secondary hyperhidrosis.